A primary hip replacement is a first-time replacement of the hip joint. The hip is a ball and a socket, and with a total hip replacement, a new socket is created on the pelvis and a liner sits within that socket. On the femoral, which is the thigh bone side, a new ball is put onto a stem that's inserted down the thigh bone, and that creates a new ball and socket joint. Commonly, it's done for osteoarthritis, which is wear and tear of the joint, and that's increasingly prevalent in the sort of older population. One of my subspecialist interests is complex primary hip replacements. So I see a lot of patients that are younger, that have congenital deformities or abnormal anatomy, and those that have been affected by either infection or trauma. And that again is a first-time hip replacement, but it's not for the osteoarthritis wear and tear. Most people that have a worn out hip and one that isn't reconstructable are candidates for primary hip replacements. They of course have to be fit enough for an anaesthetic and to have an operation, but the majority of patients that I see are. It's crucial that patients have tried all the non-operative treatment first, and that includes painkillers, modifying their activities, physical therapy, and quite often low impact exercises. But if someone has a worn out hip, whatever age, whatever medical comorbidities, most people are suitable for hip replacement surgery. Patients are walking the same day. Most patients are in hospital a couple of days, which is much shorter now than it used to be. It takes a couple of weeks to come off the crutches, and the crutches are really there just to reduce some of the post-operative pain. But by 6 weeks, most patients that come back and see me are pain-free, they're walking independently, they're driving, they're back to work. Most are going for sort of longer walks or even doing gentle exercises like doubles tennis or golf. I think the recovery is probably less these days. We're less worried about complications, so we try and get the patients going as quickly as we can. I'm also a big fan of robotic hip surgery, and I think that improves the accuracy, reduces the chance of a complication, and hopefully speeds up the recovery. Hip replacements are very successful indeed. They're one of the most successful operations of all time. They are the second best operation that patients can have at improving quality of life. Cataract surgery is number one. Hopefully that quality of life improvement comes from less pain, more mobility, and maintaining their function. Not really. There's very few restrictions. In the old days, patients would be told to not do a lot of certain movements and activities. We're less worried about that these days. So, as I said, patients are walking on the day of surgery. Many are done as day cases where they have the operation in the morning, they then go home in the afternoon or the evening. It's good to fully weight bear on the hip unless told otherwise, so that means you can put your normal amount of weight through the leg. I don't have any hip precautions other than telling the patient do not bend the hip more than 90 degrees, more than a right angle, and then rotate the leg, and that needs to be adhered to for the first 6 weeks. After that, patient can get back to normal.